This is Dr. Edward Conley for the August 21st, 2013 Vitality Today video newsletter update. Thanks to everyone who sent along questions, and we've received hundreds of questions from people throughout the United States and Canada concerning chronic fatigue, fibromyalgia, and autoimmune diseases. And in a minute, I'm going to try and answer a few of the questions that the staff and I felt could be addressed here on the video. But one thing that's important to realize is that it is clear from all of your questions that there are hundreds and hundreds of you out there who are really struggling and who are not getting the proper information, not getting the help that you need, and yet you've sent me questions that are so specific to your case that they're impossible to answer here on the video. Please get professional help. Seek out a physician that specializes in chronic fatigue or fibromyalgia, or contact us. You need professional help. You don't go to a foot doctor if you need heart surgery. There are not many doctors who specialize in chronic fatigue and fibromyalgia. And the nice thing about me and this clinic is the fact that I have spent the last 25 years treating some of the most difficult patients throughout the world. I don't follow a cookbook or a recipe that's been written out for me by somebody else. I've seen tens of thousands of people with chronic fatigue and fibromyalgia improve. And it is important for you to know that there's treatments available for viral diseases like Epstein-Barr and cytomegalovirus, both prescription and natural. There are treatments available for Krebs cycle abnormalities, which I talk about in the book, how to improve your energy where there are problems there, and most of you, if not all of you, have those Krebs cycle problems. There are treatments available, both prescription and natural, for irritable bowel and bowel problems. We're finding many, many people with parasites, as I talked about on the last newsletter. People with allergies, people with thyroid problems, adrenal problems, nutritional problems. And all of those can go together to pull you down and make you ill. And you need to be treated as an individual by somebody who knows what they're doing. So I, once again, strongly recommend to you that you get professional treatment for your chronic fatigue, fibromyalgia, and if you wish, contact us. I'd be more than happy to discuss it with you at any time, your particular individual case, because obviously there are a lot of complexities, and many of you have seen many, many doctors, been to many clinics. So contact my nurse Diane if you are interested. I will reinforce to you that you need individualized, specialized treatment. Those are available, so it's up to you whether or not you want to take advantage of them. Let's move on to some of the questions. There have been many very interesting questions that you have sent me. I will, where possible, use first names, and if the states are listed, we will talk about those. First question is from Kim S. And I don't know the state. It says, I would like to know if there are any solutions for someone who has CFIDs and reacts to medications and supplements and seems to react to everything they try and take. I've also had chronic hives and angioedema that are probably related to the CFIDs. Why does this happen, and what can be done about it? Well, Kim, the short answer, and that is it's a complex issue. but it is pretty clear that you have severe allergies. And in my experience, if treating thousands of people, usually it is severe allergy to 2 or 3 things. Even when the allergy testing shows up as being allergic, I've had some patients where they've shown up 200 allergies. They don't have 200 true allergies, but they are so allergic and producing so much histamine that they are reacting to many things. And therefore, you start to feel like you're reacting to everything. And of course, the way that our foods are made, there are artificial ingredients, and there are additives, and there's monosodium glutamate, and there are glutens added to soups, and it does become extremely confusing. In addition, many of my patients are overgrown with candida, and they've been labeled irritable bowel syndrome. But what the candida appears to do, first of all, it raises your immune system and can contribute to fibromyalgia. It also damages the mitochondria, your energy producing machinery, and can reduce your energy, but it produces over 79 toxic substances in the body. One of those is called acetaldehyde. And acetaldehyde is detoxed in the liver, but those people who are overgrown with candida start to become allergic to mold, to yeast, which is in yeast-risen breads, fermented products, aged cheeses. They start to react to formaldehyde, which is in all sorts of glues. It is in big box stores like Home Depot and Lowe's, and any store really that has a lot of glues, furniture,